Hi everyone, my name is Ziad. I'm one of the Hem-Onc Fellows at Moffitt Cancer Center. I'm here at ASH 2024 and my poster presentation is about the patterns of progression and outcomes in multiple myeloma patients after anti-BCMA CAR T-cell therapy. So the aims of this project is to describe what are the patterns of progression after the commercial CAR T-cell therapy, and also to assess the impact of extramedullary paramedullary disease on the survival outcomes. So in this study, we included 106 patients who had disease progression after the CAR T-cell therapy, and the median age of these patients was 66 years. And high-risk cytogenetics was present in 64% of these patients. Extramedullary paramedullary disease detected on imaging was present in 46% of all the cases prior to the CAR T-cell therapy infusion. And the most common sites were the lymph nodes, skin soft tissue, and paraspinal masses. So in regards to the progression, so the median time to progression in all the included patients was 7.7 months. And as we can see also from the table here, the patterns of progression are diverse. So we had about 48% of the patient had bone marrow involvement at the time of progression. A new bone disease was present in 44% and biochemical recurrence in 78%. Also, looking at this table here, we saw that extramedullary paramedullary disease was present in 50% of all the patients who were included in the study. And also what we found that patient who had a baseline extramedullary paramedullary disease, they tend to have more extramedullary paramedullary disease at the time of progression compared to those who did not have it at baseline. So what is the impact of extramedullary paramedullary disease? As we can see from the curves here, we first assess the overall survival. The overall survival for all the patients was 12.5 months. And we also assess the overall survival according to the baseline extramedullary paramedullary disease. And we found that patients who had baseline extramedullary paramedullary disease prior to the CAR T-cell therapy infusion, they tend to have a median overall survival of 7 months compared to 21 months for those who did not have a baseline extramedullary paramedullary disease. And also extramedullary paramedullary disease at the time of progression associated with poor overall survival compared to those who did not have it at the time of progression, 21 versus 7.4 months. Also, in terms of progression-free survival, as we can see from the curves here, we found that patients with either baseline or at progression extramedullary paramedullary disease, they tend to have a shorter progression-free survival. So the take-home message from this study is that we need tailored treatment strategies to improve the outcome in multiple myeloma patients with extramedullary paramedullary disease, as these patients, they tend to do poor.